this talk, I will follow the last lecture, and I will talk about effects of RF fractional on dark skin and Asian skin. And again, we always have to start with comparing of lasers and IPLs to radio frequency. So lasers and IPL are the best on things with color, and now we know that they use also infrared, so they can heat through the effect on water. Penetration of light in general, this is the physics, is quite shallow. They cannot go very deep. Treatment area is small. You don't have any kind of feedback mechanism from the tissue. And the subject of this lecture, that you have some limitations on dark skin. Radiofrequency is only on water. There's no chromophore there. Penetration can be very deep. Treatment can be very large area. You can have a feedback mechanism of the impedance, so the most relevant things to the RF is the impedance of the skin, and you can have feedback and accustom the power according to that. And you don't have a lot of limitations on dark skin, which is important here. What is RF? It's through the electromagnetic spectrum. It's like the radio waves that we have around us, used in medicine for 100 years safely. If you compare it to the lasers you see here on this slide, the non-ablative lasers, the ablative lasers, you see a bipolar RF, which is quite superficial in the dermis. It does do the fractional of the epidermis, and you see this, which is the Endymed solution, fractional skin resurfacing, that does also the same fractional on the epidermis, which is like an ablative treatment, but in the same time has also a volumetric stimulating effect up to 2.8 millimeters. So this is the device we were talking about. You can see it just here with the 6 RF generators. So to treat acne scars, we actually use 2 different technologies that we have on the same machine. One of them we call fractional skin resurfacing. It has 112 microelectrodes, 300 microns each one of them. The way it works, it's very interesting, and you can do it only with 6 generators. No other RF fractional can do that. And look how it works. I think it's very elegant. So you have 6 different generators, and it starts by 1 minus here, which is actually a line of electrodes that will be in the minus phase, and 5 on the plus. And all the plus electrodes or generators will actually emit RF towards the minus. So what you get here is a coagulation underneath this line of minus electrodes and a volumetric heating underneath all these 6 lines. Now the minus line changes all the time like that. It's like a scanner. So at the end of these 14 lines, you get coagulation of 112 points, and in the same time, what is very important, you get the volumetric heat underneath. And here you see the proof for that. These are the fractional ablative points on the epidermis, and this is filming from the side. This is the volumetric effect. So you get both the surface that you want to do for the pigmentation, for the roughness, and also the volumetric effect that you want to build the collagen underneath. And these results were, of course, published, and here you can see on Asian skin the kind of results you can have working very nicely on depressed scars. Another one, again, all the RF fractional treatments, both the skin resurfacing and the microneedles, you can use on active acne. You don't have a problem, you're not afraid of any kind of infections because it's actually coagulating or disinfecting also the areas through the treatment. Another case from Japan of both active acne and acne scars. You can very easily treat, and here I want to mention that this treatment is very easy, in contrast to lasers that you should be very careful and you have multiple risks. With the RF, it's very straightforward. You don't have to give antiviral, antibacterial, no actually aftercare at all. You don't have oozing, you just put a kind of moisturizer afterwards, because if you do have micro scabs, as in the fractional skin resurfacing, it's dry. It's not an open wound, it's not oozing. Another one, both active acne and scars. Just deep scars from Singapore, very nice effect after only 3 treatments with the fractional RF skin resurfacing, with the Endymed treatment. Another one from Singapore. You can see not only the depressed scars, but also the ice peak scars, which are more difficult to treat. This is one of my patients. Again, from Taiwan, you see different countries, all types of Asian skin. Let's go now to the next technology, which is the RF microneedle. I've shown this in the morning. These are the lasers. But what you want to do is RF microneedle, and here you want to choose a device which uses a motor which will give you a smooth insertion. You have the other technologies, one that is fixed needle. Fixed needle has a lot of problems. First of all, it's uncontrollable. You have to do it like a hammer on the skin. And second, you cannot monitor the depth. You need different needles to different depths. When you have a motor, you can choose from 0 to 3.5 millimeters by steps of 0.1 millimeter. You want to have 1.7 millimeters, you have it. You choose exactly the depth that you want to go. And then you have to look for the quality of the needles. Again, you have very low quality needles like this one that will give you trauma to the dermal epidermal junction, will give you more hyperpigmentation, the damage you don't want to do. So you want to insert through the epidermis as smooth, as sharp as possible. So the sharpness and the quality of the needles are very important. Also, the material is important. You want to have gold plated, because gold conducts electricity much better than any other metal. So if you have a gold plated, you have 2 advantages. One, the conductivity, and then less allergies. Because if you have nickel containing metal in the needles or electrodes, you can have an allergy to nickel. Okay, we know that as dermatologists, and we've seen that with other types of needles. So you want to have gold, quality gold needles. So I've shown this before. These are the hand driven needles that you have the trauma, and then you have the insulated needles that I think at the end of it are giving you less efficacy. It's less volume of heat, so you have less efficacy, less stimulation, less coagulation. So this will give you, I think, inferior results. And then you have the technology I'm talking about of Endymed. It has the smooth motor, has the full needle coagulation and heat. So actually you'll have a better effect. These are the needles. You see here 25 gold-plated needle, very sharp. Again, the comparison to other types of needle. Okay, you have so many devices, but when you look closely with the microscope, you see these kind of things, and this is what you want to have, so it's very important, the technology. These are the histologies that I've shown, very rapid healing, very low downtime on any skin type. And these are the kind of results on fair skin, but it's more important for us now to look at dark skin. And this is one of my patients with very good results, very high satisfaction. Again, as you heard about the CO2 laser, the reduction of size of the pores. For years we said there's nothing to do for that, but I think the fractional RF treatments are now maybe the only tool that can do that, at least as improvement. This is after 3 treatments with the intensive. And now we get to real Indian skin, dark skin, coming from Dr. David from India. And here you see after 3 sessions with the intensive, 2 weeks apart, 3 passes per session, you have no problem because the coverage is around 7%, so you can go 3 times without any kind of problem over the area. And you have the power settings, which are actually quite high power, long pulse time, 2.5 millimeter deep, and you see the great results, and of course no hyperpigmentation. So you go to this dark skin absolutely safe. And another one, same nice results, not only the effect, but you see the safety of that with high power. Look at this case, really deep acne scars, I think with some maybe inflammation there or some kind of bit of active acne. You see at baseline after 3 sessions, 3 weeks apart, 3 passes, high power settings, 2.5 millimeters. By the way, when the depth is shallow, you actually have much more energy because the energy will spread over only 2.5 millimeters. If you go to 3.5, you have to increase the power. So these are quite aggressive settings, and you see the great results you have here. Another patient, and this actually goes to publication, this study, very soon. Another patient, also active acne, acne scars, great results. You see Indian woman here. Pigmentation is much less after the treatment. That's, I think, very, very exciting. And the case of traumatic scar also improved. So I think this is very interesting technology, a lot of studies right here. And as a final slide, you have the device, you can do all this technology I spoke about in the same platform. Thank you very much.